As I said, no welcome at the AFL-CIO forum last night. A question from union member Steve Skvara was one of the most memorable of the night. Let's see it again.
After 34 years with LTV Steel, I was forced to retire because of a disability. 2 years later, LTV filed bankruptcy. I lost a third of my pension, and my family lost their health care. Every day of my life, I sit at the kitchen table across from the woman who devoted 36 years of her life to my family, and I can't afford to pay for her health care. What's wrong with America, and what will you do to change it?
Well, Steve joins us right now. Mr. Skvara, thank you very much for joining us. I want to learn from your horrible situation, and maybe one of these candidates will do something that will deal with it and help you and help others by the millions. The company you work for was LTV. Do you believe that they filed bankruptcy to avoid meeting their responsibilities to you and other workers?
I truly do. I believe that was their way to escape. You know, the unfortunate thing about bankruptcy with corporations is, and Edwards answered one of the questions correctly as far as I was concerned, is when they walk away from the employees that devoted all their years and their lives to that company, they lose everything on a bankruptcy. But the corporate leaders end up with million-dollar bonuses, and it's just not right. I mean, so
you're not treated you're not treated as a creditor. You're not treated as someone they owe money to.
No. And in fact, we had given up wages as people would understand, you know, union contracts. We give up wages in exchange for, you know, benefits, you know, and there's a trade-off. And
sure.
The PBGC, you know, we believed was there to guarantee our pensions. And as we found out, there's certain stipulations and language in the PBGC law that allows the companies to escape part of that. I mean, you know, like I myself lost a third of my pension.
So when you were working all those, in your good years, Steve, and you were working, what were you looking forward to as part of the deal you had with your union and with LTV? What were you looking forward to when you were really out there working on the line?
Well, it was a good future, a secure future. We were, you know, I was looking at retirement and being able to relax and not worry because I had health care and my wife would be taken care of with health care. I mean, it was written in gold, I thought, but it wasn't. I mean, you know, it sadly disappeared, and it disappears today for so many other workers. I mean,
you mean you had a health care package that was going to continue through your retirement?
Yes. That was the understanding. You know, we paid into it after we retired. After we retired, you know, we paid for part of it. But it was, you know, our understanding was it was guaranteed for life.
Do you think that the U.S. government is going to move and make up and pick up these pensions, for example, with Chrysler, where they've been sold to an equity firm, or they're about to be, and all these pensions? I'm thinking of all these guys and women like you who had big, heavy lifting jobs for the last 100 years, and you had good union contracts with the UAW, the steel workers, with big American corporations. And now the corporations are coming apart. The executives are splitting for Palm Springs or Palm Beach or wherever. And you guys are being left behind. You're being discarded.
We are. And it's a shame that this is, you know, it's being allowed to happen. And I don't know what we're going to do about it, except for the people to start talking to the politicians that make the decisions in this country and start making them realize what the real problem is, like with health care. I mean, until the other night, everybody was trying to ignore health care. You didn't hear much about it. I mean, even in the mainstream media. Yeah. And now it seems to have hit in the front page.
Well, our NBC poll, for what it's worth, I know you don't need a poll to know what life is like. You're living it, Steve, but the poll shows that health care is right behind the war in Iraq is the #2 issue in the country right now. So it has moved up. And the question is what we're going to do about it. Are you impressed by what Mr. Edwards said last night, or any of the Democrats, or any of the candidates, including the Republicans like Rudy Giuliani and Romney are talking health care too? What do you make of it?
Well, they're talking the talk, but they're not walking the walk, if you know what I mean. I mean, their answer is, well, let the corporations take care of it. I mean, even one of the Democratic candidates had made the statement, we have to invite them to the table, the insurance companies. They've been at the table for the last 35 years, and they've been eating our lunch. I said,
what do you make of
they're the ones.
What do you make of Edwards? Do you think he'll do it? Do you think Hillary will do it? I remember she talked health care 10 years ago, 15 years ago. She was doing it back in the early 90s. It didn't work out. Do Do you think if the Democrats get in the White House and they control the Congress that they'll finally get it together and do it in the next couple of years?
I sincerely hope they do. It has to be done soon. I mean, there's so many folks out here, not just, you know, a retiree and his wife, but there's a lot of young people out here trying to make a living. And without health care, there is nothing for them. I mean, it's a disaster waiting to happen. There's so many, I know, you know, single-parent homes, whether it's a husband or a wife that's taking care of the kids, and they're out there trying to earn a living, and one illness can wipe them out completely. And I mean, it's just a crying shame that this goes on.
How good is Medicaid?
Things have to change.
How good is Medicaid for you, sir?
I'm on Medicare.
And how good is it?
And Medicare is good, but now they're trying to privatize that. Something else.
I'm talking about what you live with every day. When you have to get help with medicine, when you have to get help with your wife's sickness, is it good or not?
Medicare for me is excellent. I think it's a fantastic program. It answers my needs.
But you said last night, rather dramatically, that your wife, you weren't able to, you look across the table at her and you're not able to give her or make sure that she gets the medical care she requires. Why does Medicare let you down, if it does?
Because she's not on Medicare yet. She's not eligible. I mean, she's 56 years old.
Oh, you'd have to wait at least to 62, right? Or is it 65?
Correct. No, it's 65.
Yeah. Well, hang in there,
so we're talking about 9 more years.
Do you like any of these candidates?
They're interesting. I'm not going to commit to any candidate at this time. I like the answers I got from Edwards, but I would have liked to heard a definite answer from all of them.
Yeah.
I mean, things have to change.
Can I pay tribute to you, sir? I think you've had a voice out there last night with, I looked at the polling last night of ratings, about 1 million people heard you make that plea for attention for this country to focus on medical care. You may have been more effective than any of these candidates, including Hillary Clinton, in terms of your plea. Well, so I hope, and this isn't a partisan view, I got to tell you, if anybody doesn't think that health care financing is the #1 domestic issue in this country, they're just not living here. Anyway, thank you. Steve Skvara, you're a great American to speak so well to the needs of this country.
Thank you for giving me this opportunity.
Thank you. Coming up.